Hey there, friends. My name is Kelsey, and I'm a team member here with Sarah Michelle NCLEX Review. And today in this video, we're going to be talking about the pediatric heart condition called Tetralogy of Fallot. Tetralogy of Fallot is one of the most common congenital heart defects. And I know this topic can be a little bit tricky, but by the end of this video, you will be a pro. So to start off this video, let's review some basic anatomy of the heart. So here we have just a really simple picture of the heart. And you can see that on the left side of the screen, we have our right atrium and our right ventricle. Remember, this is a mirror image. And then on the right side of the screen, we have our left atrium and our left ventricle. I want you to think of A for attic to remind you that the atrium sits on top of the ventricle. Next, we need to take a look at how the blood flows through the heart. So I want you to think about the left and the right side of the heart as being two different sides that work together. So do you remember which side of the heart the deoxygenated blood enters? It's the right. So on the right side, deoxygenated blood enters the right atrium from all over the body through the superior and inferior vena cava. Then the tricuspid valve opens to allow that blood from the right atrium to enter the right ventricle. Next, the pulmonary valve opens to allow blood to flow through the pulmonary artery, which goes directly to where? To the lungs, where it gets oxygen. Now let's look at the left side of the heart. So oxygenated blood travels from your lungs to the left atrium via those large veins called pulmonary veins. Then that mitral valve opens to send blood to the left ventricle. Next, the aortic valve opens, which allows that oxygenated blood into the aorta and then out into the entire body. One big thing to note here is that deoxygenated blood should never be going into the body under normal circumstances. Instead, deoxygenated blood is coming back to the heart from the body, then to the lungs to get that oxygen. And that's when it's pumped out into the whole body. However, when we have certain heart defects like Tetralogy of Fallot, deoxygenated blood is actually going into the body. So now that we have our basics down, what exactly is a congenital heart defect? So put simply, it's an abnormality in the heart that develops before birth. While there are many different types of congenital heart defects, as you already know, today we're talking about Tetralogy of Fallot. And Tetralogy of Fallot is a cyanotic heart defect, meaning there is not enough oxygen in the blood. Tetralogy of Fallot is unique because it actually has 4 different features that make up this defect. And those 4 features are a ventricular septal defect, right ventricular hypertrophy, an overriding aorta, and pulmonary stenosis. And I want you to remember this by thinking, don't drop the baby. D for VSD, or ventricular septal defect, R for right ventricular hypertrophy, O for overriding aorta, and P for pulmonary stenosis. So let's look at what each of these components mean for our client. So first, a ventricular septal defect, or a VSD. That's when there's a hole between the left and right ventricles. This hole allows deoxygenated and oxygenated blood to mix between the left and right side of the heart, just as you can see in this picture. Pulmonary stenosis is that stiffening and narrowing of the pulmonary valve, which causes the right side of the heart to work a lot harder. And when we look at the next defect, right ventricular hypertrophy, that makes total sense. So this is the thickening of the muscular walls of the right ventricle, and this occurs because the right ventricle is pumping too hard. So think about your muscles when you exercise. Over time, your muscles grow if you work them out, right? So the same concept applies here. That muscle is having to work extra hard to make up for this defect, causing the thickening of that wall or that muscle. So then we have an overriding aorta. And this is where the aorta is positioned over that ventricular septal defect instead of where it normally is, which is in the right ventricle. So this means that the aorta is carrying out not only oxygenated blood, but deoxygenated blood as well. And as you can see, all 4 of these defects kind of contribute to each other, leading to our diagnosis of Tetralogy of Fallot. So now I want to discuss what we may see as some signs and symptoms in an infant with Tetralogy of Fallot. So let's think about that ventricular septal defect and that overriding aorta. The 2 of those are causing oxygen blood and deoxygenated blood to mix together and be sent out into different parts of the body. So I want you to think of deoxygenated blood as being blue and oxygenated blood as being red. This deoxygenated blood in the body causes a decrease in the arterial oxygen saturation, leading to infants to appear how? Blue. So this cyanotic color happens because that deoxygenated blood has entered their bloodstream, giving that baby's skin and lips that cyanotic color, just like this infant here in this picture. On your physical assessment, you may hear a systolic murmur along that left sternal border. You may notice some tachypnea, a low oxygen saturation, or even some clubbing of their fingernails. So another unique feature to Tetralogy of Fallot are tetralogy spells, also known as Tet Spells. The etiology of this phenomenon is not well understood, but it typically occurs when an infant becomes upset. And you may see this occur during feedings, times of distress, or even play. And Tet spells are characterized by episodes of irritability that include rapid respirations, eventually leading to severe cyanosis. Tet spells can sometimes resolve on their own, but if an episode continues, it can actually lead to cardiac arrest. So do you remember how these are managed? We want to make sure the infant is placed in a knee to chest position, just like you can see in this picture. And why is that? Well, that position increases systemic vascular resistance, which promotes movement of deoxygenated blood from the right ventricle into the pulmonary circulation instead of the aorta. So if you ever work in pediatric cardiology, you may see a clinician administer oxygen, a fluid bolus, IV pain medication, or even a beta blocker to help with the Tet spell. But remember that this is not something that we're going to be deciding on as the registered nurse. So I do want to point out that these infants will eventually need surgery to ultimately repair the heart. And oftentimes this involves multiple surgeries before 1 year of age. Okay, friends, let's end this video with a little practice question here. So the registered nurse is developing a plan of care for an 11-month-old client with Tetralogy of Fallot. Which of the following nursing diagnosis would be appropriate for this client? And if you need a minute, go ahead and pause this video. Okay, I know you all got this one. So the answer is A, activity intolerance. So clients with Tetralogy of Fallot cannot always tolerate normal activity that other infants can. For example, this child may not be able to play like their peers without having one of those Tet spells. So let's look at the other answer choices and discuss. We know that in Tetralogy of Fallot, a client's airway is not the main problem. This condition is primarily affecting the heart, not the lungs. Option C is risk for fluid volume deficit. What do you think about that answer? Well, we would not expect to see this since Tetralogy of Fallot does not lead to dehydration or fluid volume impairment. And then finally, risk for impaired liver function is, again, not something that we would be concerned about in these clients because our primary concern is the heart, and we would not expect this defect to affect the liver. Okay, here are some key takeaways to keep in mind for the NCLEX. First off, Tetralogy of Fallot is composed of those 4 things: ventricular septal defect, right ventricular hypertrophy, an overriding aorta, and pulmonary stenosis. Remember, don't drop the baby. Next, this is a cyanotic heart defect. Think of that blue color and that deoxygenated blood throughout the whole body. And finally, watch out for those Tet spells, and if they occur, put the client in that knee to chest position immediately. Okay, guys, that's a wrap on Tetralogy of Fallot. You are one step closer to becoming a real deal registered nurse. Thanks for joining me today, and we hope to see you back here with another content video. Be sure to hit subscribe so you don't miss out on our newest videos. Happy studying!